So one of the big advances recently is in egg and embryo freezing using a flash freezing technology called vitrification, compared to what we were doing 10 years ago, which was slow freezing. Vitrification has resulted in about a 90% freeze-thaw survival of oocytes, and we can now store oocytes for people who want to do social egg freezing or preserve their fertility with a lot of confidence. And the whole process is no longer considered experimental. It's considered standard of care. The other big advance with vitrification is embryo freezing, especially going to day 5, because the embryos essentially survive almost 100% with vitrification. So if patients have multiple embryos, we just put one embryo back and we freeze the rest. And if people overstimulate, we have no problem at all now freezing all the embryos, letting everything settle down, and then putting embryos back one at a time. And as I said, the blastocysts really survive the freezing and thawing very well. And the pregnancy rates are now actually a little bit higher with frozen embryo transfer than with fresh, based probably more on the timing of when we put the embryos back. But it does tell us that the vitrification is not harming the embryo at all.